Okay, so have a look at these exercises first and then let me get back to the point of the video. So this is the front of the hip stretch in a lunging position. This is the outer hip stretch for the glutes in a seated figure four position, and this is the hip flexion can be loaded with the help of the band. So I've been working with this person who's been battling the front of the hip pain for more than 5 years now, and wearing socks or shoes or going for a jog like the way he used to be able to do is not something he's able to do now, and also playing squash is out of the window. So we figured out that in the 5 years window, there is a lot of stiffness and tightness that's happened around the hip now, and muscle strength around the hip is drastically lower compared to the other side, especially. So we just need to put one step at a time now, start working on the movement. That's how we started. The exercise that I showed at the start is something we had used at the start of the rehab, and then we just progressed it further. The goal is to obviously improve the mobility, get the movements right, and then the strength of course, when it comes to specifically the front of the hip. Especially if you have a job where you have a lot of sitting involved, then your hip flexor muscle is in a constricted, contracted position for quite some time, a number of hours in a day. So we must counter it through specific exercises and get stronger for long-lasting results. So there's no quick fix for it. Yes, soft tissue release can give you some relief, some passive stretching is good, but there has to be some homework exercises that you do on a regular basis to make sure that the good result that you've gotten through the exercises at the clinic when you're working with the physio is maintained for a long term, if you can do some exercises at home as well. So all the best with your chronic injuries. Let's get this cracking.